Hello and good morning, everyone. Thank you for attending the first session of the 2021 North Country Leadership Summit, Emerging from a Year of Change, an Opportunity to Rebuild and Reimagine. This is a collaborative effort between AHI and Fort Drum Regional Health Planning Organization, and we hope you enjoy today's session and all the sessions to come this week. So we just want to give a quick thank you to our sponsors. Without these sponsors, we would not be able to put the event on. So thank you for their support this year and their continued support from years ago. And then lastly, I just want to go over a few housekeeping items for today's session. Should you have any questions or comments, please place them in the chat and the AHI staff or Erika Flint will be able to answer them during the Q&A at the end of the session. We ask that all attendees remain muted and the video is off during the presentation. This just ensures the best connectivity for everyone on the session. And then all presentations, so this presentation and all the rest for the week will be recorded and archived on the North Country Leadership Summit webpage by October 1st. For this session specifically, all attendees will be entered into a raffle to win a prize package. That will be pulled after this session and we will notify you via email during this week so we can get it out to you next week. With that, I will turn it over to Sarah Wright, AHI CFO. Okay, hold on one second. I think Sarah lost connectivity. Oh, there we go.
Hello, can everyone hear me?
Yes.
Sorry about that. Starting right off with some technical difficulties. So good morning and welcome. So I just wanted to take a few minutes and walk through a little bit about AHI, who we are, the areas that we serve, and what we're all about. So the first thing here, we have some information on AHI. As many of you I'm sure know, we are an independent nonprofit organization that supports hospitals, physician practices, behavioral health providers, community-based organizations, and individuals throughout the Adirondack region. We're looking to transform healthcare and improve population health. And then on the next slide, we do have 5 member organizations. As you can see, AHI is in the blue center below, and we partner with St. Lawrence Health Systems, University of Vermont Health Network, CVPH, Hudson Headwaters, Adirondack Health, and Glens Falls Hospital. And then what we want to show here is just to the left, a list of a lot of our programs that we work with. And then on the right, our 9-county region and the different areas we serve. You can see with the tick marks where all of the programs that we work with operate throughout the region. And then on the next slide, we just wanted to show how vast our area is. So the Adirondack Park is highlighted in green on the upper right. It does consist of 6.1 million acres. So by comparison, it is larger than the state of Massachusetts. And a little fun fact, you can fit Glacier, Yosemite, the Great Smoky Mountains, Yellowstone, and the Grand Canyon all within the same mass. So just showing how far we reach within 9 counties of the upstate and Adirondack area. And then next, I want to just go over a few programs in more detail. Please take a look at our website for more information. That's ahihealth.org, where we do highlight all of our programs and you can find additional information. So the Adirondack Rural Health Network, also known as ARHN, provides a forum for public health leaders, informs on planning assessment, and provides education and training to further New York State DOH prevention agenda initiatives. The next program we have is Clear the Air in the Southern Adirondacks, also known as CASA. This is an Advancing Tobacco-Free Communities partnership grant funded by the New York State Department of Health, Bureau of Tobacco Control, and it seeks to build healthier communities through tobacco-free living in the counties we serve. Next up, we have ADK Wellness Connections. I'm sure many of you have heard of this, and if not, it's a free referral network that helps connect individuals to a wide range of resources in their communities to improve health and well-being. Again, for additional information, you can visit our website or contact our program leads, and as noted in the email addresses below. And we do have a short video here on the next slide to provide additional information on these services.
Physicians and healthcare teams. When's the last time you had a patient in your office who needed help with housing, nutrition, finances, or another unmet social need? You can't ignore these needs, but you also aren't an expert on the community-based organizations that can help. So you get stuck in a flurry of faxes, phone calls, and resource guides. Sound familiar? Well, getting your patients connected to the care they need has gotten a whole lot easier and more effective. ADK Wellness Connections is a referral platform available to you at no cost, where you can refer to a coordinated network of medical and social service providers in your region. It's built on the same advanced technology leading healthcare and public health systems and state agencies are using to power similar cross-functional networks across the country. Here's how it works. You identify an unmet social need through your routine screening process. Then, you or your team member takes 5 minutes to enter the patient's basic information, like name, date of birth, and needs into the HIPAA-compliant platform, and then chooses an organization to receive the referral. Or, if you're not sure which organization can help, you can select your local coordination center to do the work for you. No phone calls, no faxes, no searching for services. And the best part? You should know within 2 business days if the organization receiving the referral has accepted it. All it takes to start the process is to complete a brief registration form. Then, users within your organization can participate in online training to become familiar with the platform. Many organizations begin by training just 1 to 3 people to get up and running as quickly and smoothly as possible. And remember, this powerful referral platform is free to all service providers and community members. Your care coordination team deserves ADK Wellness Connections. So do your patients. Visit adkwellnessconnections.org to get started today.
Okay. So the next 2 programs that I'd like to highlight assist with our community members through connecting them with health insurance benefits. So on the left, you'll see we have our CHAMP program, which is New York State's Community Health Access to Addiction and Mental Health Care Project. This is a program that helps individuals with their families access needed substance use disorder and mental health treatment services, and also get the most from their health insurance benefits. And on the right, we have EASE, which is our Enrollment Assistance Services and Education. And this is where we assist individuals, families, and small business owners to enroll in health insurance coverage through the New York State Health Marketplace. So we do this through our navigators that help navigate the website and enroll individuals. On the next slide, AHI is also serves as the lead health home for care management organizations in the region. Care managers assist individuals with linkage to social services, behavioral health treatment, and healthcare providers in the community to reduce avoidable hospitalizations and improve their health and well-being. So again, additional information can be found on the website. There's also an 800 number on the slide for more information. And then on the next slide, the last program that I'd like to touch on is the North Country Telehealth Partnership. AHI and Fort Drum Regional Health Planning Organization partner together to form the North Country Telehealth Partnership. This rural health network grant supports telehealth by AHI and Fort Drum serving as a resource, helping partners to assess their needs and readiness, connecting organizations to specialists, providing insight on equipment and vendors, helping navigate through regulatory and reimbursement questions, organizing educational opportunities, and sharing grant information. So with that being said, I'd like to turn it over to Erika Flint, Fort Drum Regional Health Planning Organization CEO, to tell you a little bit more about the programs that they work with.
Thank you. It was a delay on letting me unmute, so appreciate that. Again, my name is Erika Flint, and I am the Executive Director of Fort Drum Regional Health Planning. Good morning, everyone, and thank you for this opportunity to briefly describe our organization. Next slide, please. So our region is actually designated by the state as the Tug Hill Seaway Valley region. We are along the Canadian border and the St. Lawrence River. We are also home to Fort Drum. It is the only Army installation with a division that does not have its own hospital. That was by design in the 1980s. We have an integrated model that has shares a hospital, shares schools, shares housing. We actually have the majority of our housing out in the community. That worked very well. It was an informal design. There was excess capacity in our hospitals and our healthcare system. CEOs would get together with command maybe once a month and chat over coffee. And informally, it was a very a good system. However, in the early 2000s, we had the 10th Mountain Division had a significant growth with brigades added. We reached about 20,000 soldiers strong, and it was decided then to do a pilot program at the time and analyze the system, see if it was strong enough to remain. And if so, what may be needed to change or support that was necessary. At that time, we became a 501c3. It was decided that not only was the program sound, but it was something that could and should be potentially replicated across installations. It was decided that our quality was much higher than a lot of the installations. It allowed the community to be good at healthcare and the Army to be good at being an Army. So at that point, our boundaries became a 40-mile radius with 5 hospitals. And serve the region to analyze the system on an ongoing basis, identify gaps, and then we are positioned to leverage resources to fill those gaps. Next slide. This is a pretty complicated slide, but I think it'll be a resource after for some of our participants. But at a quick glance, we do have towards the middle, you'll see a column that's labeled medical treatment facility. This is actually MEDAC. It is the services that the military provides on the installation. So while they do not have their own hospital, they do provide primary care, all primary care for their dependents, as well as some specialty care and behavioral health care. In the middle are the services that are in the community, but shared with the military. So these are services that, for instance, there's OBGYN services. It's actually federal property, but it's shared in one of our healthcare hospitals, Samaritan Medical Center. And then when the woman is ready to deliver, she delivers in Samaritan's facility with providers from the military. So those are some of those shared services at the space, and the providers are shared. We also then have many of our services out in the community, again, with our 5 main hospitals, and then also Claxton Hepburn has come into the fold as well. And the goal is kind of what I had said on the last slide, is that ultimately that the military is ready. That is their number one goal, ready for any time that they're called up. As many of you know, that 10th Mountain Division is one of the most deployed divisions in the United States military. And so our job is to make sure that they are medically ready and we have that healthcare that serves them. Next slide. This is a visual map. It does, break out where those hospitals are located. I would also point out that given there is no hospital on the installation, we have shared mutual aid for EMS services. So if there are emergency services needed either in their housing or something with military training of that nature, that they are then met up with at mutual aid points and transported out into our hospital, community hospitals. And then an understanding, just like our own community members, there are some specialty services that soldiers will need to travel outside the region and beyond, part of a referral network that's quite similar to civilians. Next slide. So within our service areas, we really have 5 main topics. When we first looked at the pilot program, there were 5 areas. One was behavioral health, the other technology and telemedicine, something that the majority of you are here and interested in today. Also healthcare workforce. We are a service provider shortage area, so that is a focus of ensuring that we have the workforce needed. I did describe EMS already briefly. And then in population health, that originally was quality. But as I said, after several years of monitoring the quality, it was decided that quality wasn't an issue. If anything, it was actually better. But as both the civilian and the military communities have realized, is that population health has a much greater impact on our health. Where people live, work, and play has much more to do with health outcomes than by the time someone's in primary care or certainly in a hospital setting. So within those areas, we have focused specifically with behavioral health on the integration of primary care and behavioral health, adding lots of providers and treatments centers that we can address those, and also expanded into SUD. I'll go into technology and telemedicine a little bit more. Healthcare workforce, our approach is a pipeline approach, working with students in middle school and high school, all the way up to folks that are in residency programs, and sometimes recruitment from outside the area, and incentivizing relocation here. Next slide. So technology in a bit more detail. Some of our focus areas there are health information exchange. We run Healthy Connections, so all of our providers are connected. We run EMRs on top of that, but we also are one of 3 locations in the nation that has connected to our installation. So if a soldier were to be out after hours, broke their arm, was seen in the emergency department, when they were to go the next day to primary care and follow up, that would be, those records would be connected on the installation, and they would be able to have that view, which is quite significant given security and the ability to work with the military. Practice transformation, we run PCMH across our region for all of our primary care providers. They are all at the highest level possible. We also have analytics resource group. This is for actual hire. So we contract with partners regionally and across the state, and we provide risk stratification tools. We create apps, anything that we can do to get at a patient level data, risk stratifying for patients across those particular program areas. So specifically in our region, we run an IPA, an ACO, and we're able to use that data for different contracting. But we work with partners, hospital-based, colleges, universities, to be able to look at this patient level data and kind of see, what they want and be able to create something accordingly. We also provide IT services regionally. These are services from telephone networking, VPN, updating servers, help desk, any type of IT services, we have a lot of providers that are small, and this is a win-win. They may not have the ability for full-time advanced IT services, and sometimes contracting out with for-profits can be costly, whereas a nonprofit, it is a win-win. It is revenue for us, but at the same token, we're ensuring that our partners are have the highest level of functioning IT necessary. And then in that same vein is privacy and security that continues to come to light across the nation, and ensuring that we have that highest level of services to our partners is essential. Next slide. So for just a second here, again, Sarah did touch on the North Country Telehealth Partnership. I won't repeat that. Those last three slides, three bullets encompass that. But on the very top of that is the North Country Telehealth Project, and that is the fiber in the ground. So we actually have two networks. We have the NCTP, but we also have Action. And you can see a map. It really encompasses the top half and top corner of the state. And it's the fiber in the ground to make sure that we can carry all of the telemedicine work. And when we talked about the connections between our providers and the military, that we have the speed and we have the redundancy and we have what we need necessary to be efficient. And next slide. So at the very end, our model really has three key components. It's probably in any type of partnership, but we have that open communication. Med Command sits on our board. Without them, we don't have a quorum. We have all of the folks, hospital CEOs, folks, leaders in behavioral health and mental hygiene and public health and health workforce at the table in a position that they can make decisions necessary to ensure, again, those identified gaps are met. And so there is kind of a visual of that. And I will stop there for either any questions now or however, if they're at the end.
Thank you so much, Erika and Sarah, for the great overviews on AHI and Fort Drum Regional Health Planning Organization. I think it's very important for our partners to hear about this, because I think a lot of the folks that joined the summit or previously the telehealth conference as well know about the telehealth program or ARHN, but there's so much more to the two organizations. So definitely feel free to reach out to anyone at AHI or Fort Drum if you have any questions on what was presented today. We just wanted to highlight some of the presentations and what will be going on for the rest of the week for the summit. We have a great list of presentations lined up. Every day this week, we will have presentations at 10 a.m., 12 p.m., and 2 p.m. Today, we're going to kick off our first presentation at 10 from Andrew Solomon of the Northeast Telehealth Resource Center. He'll be presenting on telehealth in 2022, a focus on patient engagement and quality improvement. At 12, we're going to hear from Josh Stefani of Comfort Food Community of Washington County and Brittany Christensen of ADK Action. They will be presenting on advancing food insecurity initiatives through community partnerships in the Southern Adirondacks. And we're going to close out today with a presentation from Julia Prusik of Hicksney on leveraging SMART on FHIR to share actionable healthcare information. And then throughout the week, we'll be hearing from a lot of great experts in telehealth, digital health, and population health. So if you haven't yet, please take a look at the AHI Summit website, where you could see the full list of presentations and registration links. If there are any questions, feel free to pop them in the chat, or we can close out the session. And we just wanted to thank everyone for joining this morning. And again, we will be drawing a raffle after this, so check your email. We'll have a couple of lucky winners that you'll be hearing from us shortly. Thank you all for joining today. I don't see any questions coming through the chat, so I think we'll go ahead and close out the session. Again, thank you so much for Erika and Sarah for giving those high-level details on our organizations. Thank you all.